Now we mentioned about the discs. So in the center of the disc is the nucleus, this part here, nucleus propulsa, because it is kind of like a gel cushion sort of thing. And then we have annular fibers, and these kind of go in alternating rings. So in one layer, I always think of these almost like fences. They are angled at one diagonal, and the next layer is going at the opposite diagonal, and they go across and back like that all the way out to the surface. And that facilitates as well a certain amount of movement. So as the spine rotates, for example, some fibers will go slack and some will tension.
Mm-hmm.
If we move too far, we stress these, sometimes this gel center can start to push through. It starts to actually break down. It ruptures some of those angular fibers. And if it becomes severe, it can start to herniate and it can either push into the spinal canal where our spinal cord is, or more often out to the side where we get what's called a posterior lateral bulge. People who've had MRIs will probably be familiar with that terminology. They might not have known what it meant, but it basically means to the back and to the side. Posterior to the back, lateral out to the side. Because this area doesn't really have as much support. At the front we have a ligament and at the back we have a ligament. So anterior bulges and posterior bulges are less common, whereas these posterior lateral bulges are pretty common.